The headline medical stories that affect you and your family. This is What's Happening in Health, sponsored by TriHealth.
Morning, everybody. Welcome to What's Happening in Health. So glad you are joining us today. Got a great show planned for you, beginning with some changes to healthcare happening in Wilmington. We're going to share the very latest. Clinton Memorial Hospital and its partnership with TriHealth, kind of the new thing here. And in the house today, we want to welcome Terry Hanlon-Bremer. She has been closely helping to meet the needs of those in our community in several areas for several years. And she's going to share the latest on what we need to know about population health and this partnership in our community. So glad to have you on board today. And we're going to share the latest on new technology. It is changing lives in those who need wound healing. This is a patch, not a pill. We'll explain how it works. But first, quick headline for you today. It is in Gut Instinct. There are a lot of reasons to eat by color, but have you noticed what's in season right now? Colorful fruits and vegetables, watermelon, cantaloupes. These foods not only give your body nutrients needed for body and soul, but these colorful vegetables, cucumbers, celery, they also allow you to eat your water when it's hot outside. Here's why colorful foods are so good for you and good for your gut.
Eat by color means make sure your plate is colorful. So sometimes we have really dull looking plates, right? You've got just a bunch of breads or rice or chicken nuggets, which those foods can be great on their own, but are you getting your colorful fruits and vegetables on your plate to give you that variety?
Other good gut and hydration foods, according to the team at Kroger Health: zucchini, tomatoes, mushrooms, and strawberries. All right, on now to our top story today, which is in high-tech health. And these hotter temperatures are a catalyst for many for kidney stones. Now there is new technology. It is called the CVAC system, and it's quite a game changer for those who've struggled with those kidney stones for a long time.
They found my first kidney stone about 12 years ago.
Marjorie Nadler has had several procedures for kidney stones, but each time
they often couldn't reach all of them or pieces of it, and so whatever was left would continue to grow.
That is, until she was referred to Dr. Matt Love of Ohio's urology group. He was one of the first in the world to use this new CVAC system to treat kidney stones as part of early clinical trials.
So this is a newer device that incorporates aspiration and irrigation into a single device scope.
As this animation provided by Calyxo Incorporation shows, with the help of tiny cameras, doctors can use this system to break up the stone. They then use water and a vacuum continuously to clear the stone fragments out of the body.
It's really very delicately sort of carving off the edges and slowly dusting it to very small fragments to allow us to aspirate it.
That means for those such as Marjorie Nadler, after the procedure, Dr. Love can tell her,
now you're 100% stone free, and I can visually confirm that with the scope.
Marjorie says after years of always worrying the stones would come back.
For me, it's a big game changer. Knowing that I don't have stones is just great peace of mind.
Now, early data on this shows about 97% stone clearance, as they call it, and those stones do appear to stay gone. The procedure is covered by medical insurance plans. All right, on now to legal medicine today. It's topping this half hour. A doctor at Cincinnati Children's Hospital hopes that her research will continue to inspire policy changes that would make sure that you know if you're at risk for what's called third-hand smoke.
The third-hand smoke is the residue that is left over by folks who have smoked in different environments. So, for example, if you are a non-smoker and you go and you rent an apartment and there were smokers that might have lived in the same apartment even, 10, 15, 20 years ago, the residue left behind from all of the tobacco that they smoked remains in the apartment itself.
Now, Dr. Gitten's team found when especially children are in these environments, they wiped their hands even years later, and they found that on their hands there were high levels of nicotine. While we don't know about the immediate impact, previous studies, she says, have shown that those who have nicotine on the hands do have it wind up in the body. You touch your eyes, your nose, your face. No amount of nicotine, she says, in the body is considered safe, especially for children. All right, just ahead, the team at TriHealth teaming up to expand access to care in our area. Terry Hanlon-Bremer in the house. She's going to share how it could impact the health of the Wilmington community. Stay with us on What's Happening in Health.
This portion of What's Happening in Health is sponsored by Metro and Gastro Health.
Welcome back, everybody, and we are turning now to some big things that are happening in the Wilmington community with the team at TriHealth. We want to welcome back Terry Hanlon-Bremer. She is the Chief Operating Officer. I think when we first met you, you were still working in a nursing capacity. How many years now have you been with TriHealth?
18 years, Liz.
Oh,
it's been wonderful.
Yeah. And you know, there's such an appreciation in the people who work there when people have sort of worked in other areas.
Oh, absolutely.
Do you find that?
You do, because you have that longevity, you get to know people, you know the history. So many times I'm playing the role of historian.
You know who to call.
Yeah. Absolutely.
Boy, that's so true. Well, we reached out to you because you recently announced a new partnership. Tell me just a little bit about that.
Yes, so we have got an acquisition underway with Clinton Memorial Hospital up in Wilmington, and that is really wonderful. That is a great community of about almost 45,000 citizens. And Clinton Memorial has been doing really great care for 75 years. They have a legacy landmark up there. And so this partnership, or actually acquisition, allows us to extend our integrated clinical network up to Wilmington, really open up access for folks, and bring our population health model to light.
All right, well, I want to talk to you about what that means, but we did recently have a chance to talk with your president and CEO, Mark Clement, about this new, I'm calling it a partnership until the acquisition goes through. I was told that's sort of what it is. But he talked to us about Clinton Memorial Hospital. Listen to this.
You know, we've been on a journey to get healthcare right, and getting healthcare right is all about delivering the right care in the right place at the right time to produce the right clinical outcomes. Increasingly, the right care is in the community.
That means as Clinton Memorial Hospital becomes the 6th TriHealth hospital in our area, President and CEO Mark Clement of TriHealth says the goal is to expand what is available here in this community and continue a strong referral partnership with others that surround it, such as Bethesda North and Good Samaritan Hospital. The hope?
Actually delivering more care in the local community and creating a gateway for seamless access to the most advanced, most complex care when a level of care above what's typically provided in a rural community is required.
The two hospitals have already been working together to help meet the needs of those who live here for the past few years.
We provide obstetrical services and lactation services to patients at Clinton Memorial Hospital. And a year ago, we welcomed 9 primary care physicians, a very well-respected primary care group in Wilmington. We welcomed them into our system, and they are now TriHealth Physician Partners Wilmington.
By integrating electronic medical records and additional access for those who need it in the Clinton Memorial Hospital system to specialty care.
Our nationally recognized service lines, you know, Heart and Vascular Institute, the Cancer and Blood Institute, Neurosciences, and others, will really extend into that community, bringing world-class care to the residents of Clinton County.
Mark says more than 500 employees who work in the hospital will become TriHealth team members. And as for investments into new technology with this partnership, those are planned.
In imaging technology, MRI and CT, as well as in oncology, radiation oncology, and others, just routine capital. So we expect to be investing to really elevate, not just the level of care, but the technology that supports that care.
So we love that, he highlighted sort of what you bring, and you can have all that, but if the community doesn't embrace it or use it, I think I read only like 1 in 4 or something actually has a primary care doctor that they feel in some way connected to.
Right.
Yeah. So tell me a little bit about how this fits into what your population health goals are, and what is population health?
Well, population health is really around taking a population and helping it be the best it can be from a health perspective, whether that is someone that has chronic conditions like diabetes, hypertension, or to get folks that are really moving upstream to prevention so that you can get before an exacerbation of a chronic condition occurs. But how do we manage that really well? So for us, the core of this is really the primary care relationship. We want every individual to have a relationship with a PCP, a primary care provider, so that the individual and their PCP can actually create a game plan for that person to achieve their best health that they can have.
So it's interesting that you started there. He said you already have a primary care practice. Are there plans to expand that?
Well, right now we have 9 primary care providers up in Wilmington. We just recently have had them on board for the past year. We're always looking to add to that because we know if you have a solid primary care base, then you can get access right. And so we'll build upon that.
So anytime you go into a new community, you sort of research their health needs. What did your research show?
For Clinton County, it really is similar to here in Cincinnati, which is the chronic conditions, diabetes, hypertension, mental health. We know mental health is playing more and more of a role within people's health overall. And so we'll go in and address it like we have down in this community in Cincinnati.
So we have a little video. We were able to get some drone of that hospital and whatnot. And what I wondered is, you know, when you say it sort of matches the needs, one of the things we know is that when you get more care within 15 minutes, 20 minutes of where you live, you're more likely to access it. And you can see differences then in even death rates and zip codes and things like that. So talk to me a little bit about how you kind of measure, because that's really the goal, to see what happens.
It is, you're absolutely right. We look at having locations in a community where it's no more than 15 minutes to get to it from where you work or where you live. And that's important because we know if you can get there easily, then the barrier of transportation and time becomes eliminated. Then the second part is how do we make sure we have enough access points? So besides having the locations, we want to make sure we have enough providers that are on site. So that starts with your primary care provider base. We also want to add specialty care so that we can make sure that it's not hard on somebody to actually go in and see their specialist if they need a specialist. But it all starts with location.
Yeah, it is really interesting. So what I wondered is, it used to be that people would have to drive a distance and most of the care was done inpatient, and that model is shifting, is it not?
It has. Really where care is going is the ambulatory space, and as Mark has alluded to with population health, it's getting the right care at the right place and the right clinical outcomes. And we're seeing more and more of that being done in ambulatory. That means outside of the 4 walls of the hospital. And that's good for a variety of reasons. One is access, obviously. Secondly is we can get more into prevention and trying to avoid an exacerbation or an unnecessary emergency room visit. And then be able to also manage costs for both the individual and an employer.
I have heard about the costs kind of, it just makes a huge difference if you have to put people inpatients while you want them in their homes and in these situations. So I think that's my final question. I've been reading that a number of rural hospitals have had to close. And one of the things you may bring then is, they say we always blame like Medicare and Medicaid and reimbursement, but really it's that when you have a larger health system, the other insurers are sort of on board with you, so it allows you to be more inclusive, get better rates, that kind of things. So is that all part of the financial model as well?
Yeah, from a financial perspective, Clinton Memorial has a nice mix of their Medicare, their commercial, and their Medicaid population. It really is around what Mark will call economies of scale. So take the financial out of the way, but how do we help with back office opportunities? How do we help support the expansion of services up there? And then if we're doing the right care, we don't worry so much about the finances. We want to do the right thing for the individual. How do we help them get into a good care pathway, have a strong relationship with their PCP, get in prevention mode, and then obviously everybody's going to benefit financially.
Yeah, and then the final thought, you've launched this Helix program.
Yes.
And so will that eventually be available to even the rural areas?
Yes, Helix is our DNA discovery. It's really around precision medicine and genetic testing around hyperlipidemia and breast cancer, and then Lynch syndrome, which is colon cancer. That is a free service for the community where you can go in and get your genetic testing and see if you're predisposed to one of those 3 conditions. And if you come up positive for the gene mutation, then you'll get connected to our genetic counselors and go into care so that we can, again, prevent any kind of issues down the road.
I am so interested to see how that could really shift some of the prevention numbers with things. But I mean, that could be be a real game changer.
Absolutely.
Yeah. Well, we are thrilled to sort of hear more about this. We're going to continue to follow the partnership. We'll have more in our third half hour from this team as well. As you say, it starts with primary care. So please, if you don't have a primary care provider, 513-853-2100, I know is your team. And I do know if you call them, they have a variety of where do you live. They ask the right questions to get you connected. So thank you for your spirit. Thank you for your passion. It is a pleasure to share your work.
Thank you, Liz.
Yeah, good to have you. All right, just ahead for older adults, wounds that won't heal can have life-altering consequences. In Healthy Caregiving, we share a breakthrough solution. Stay with us.
This portion of What's Happening in Health is sponsored by Northern Kentucky Area Development District.
In Healthy Caregiving today, when an older adult gets a wound from a bed sore or any other complication, it can have serious consequences. Now the team at St. Elizabeth Healthcare, one of the first in the area to use a new patch system to help patients use their own body to heal. It helps those such as Terry Williams not lose a leg after he had a serious foot wound. It is made by a company called Reaplix. Tom Fink and Terry talked to us about this recently on our health show.
So what we do is by taking 18 mLs of the patient's own blood, what we do is we concentrate all the good stuff in his blood down right through our centrifuge. So we have 3 billion platelets along with 50 million leukocytes, along with Terry's fibrin of the blood, which gives the patch structure. You know, it's just a concentrated dose of the patient's own just growth factors and healing factors. You introduce that into the body where he unfortunately wasn't getting the necessary blood flow down to those lower extremity wounds. It really starts waking things up.
Now, Terry did blood draws for this that create the patch for 20 weeks, and he also improved his diet and lifestyle. He's lost 120 pounds. He is now completely healed. In Minding Your Health today, if you've been feeling like nothing makes you happy, psychologists say this isn't really all that uncommon. A study found to end what they call rumination, the feeling that you have no joy, you have to engage in problem solving. For example, it is suggested you try a mind-body relaxation class such as yoga. It might connect you to other people. These are just a few steps, they say, that those who do manage to dig out of this feeling say can make a difference. If yoga is not your thing, really any kind of exercise, they say, can help connect you to others. And this is according to a recent report in Very Well Health. A few of the other things suggested include drinking less alcohol, getting more sleep, the path to sanity always, finding a hobby that connects you with others, and considering professional help if these don't seem to help dig you out. We do want to remind you that Glenwood Behavioral Health does have a 24/7 referral line. If you do need help, you can reach someone at 877-707-2612. All right, just ahead, new research on your body and your diet. It just busted a major weight loss myth. We're going to share it in Body by Design and what's happening in health. Welcome back in Healthy Diversity. A disturbing study released this week on opioid use. Patients who come into the emergency department, they found following an opioid overdose, have about a 1-year mortality rate of 5%. Now, this study found 1 in 5 of those then were given a referral for outpatient treatment, and 4 in 10 were given a naloxone kit or a prescription for medication to help them get off opioids. But researchers found Black patients with suspected opioid overdose were less likely to receive outpatient treatment referrals compared to white patients. The authors of the study, published in JAMA Network Open, say targeted interventions are needed to address these disparities. In Body by Design, a real myth buster today. You may have felt or heard that thing we've called weight loss resistant. It means that no matter how hard you try, you just can't seem to cut back on calories and move the number on the scale. Well, now a new study suggests that diets such as the Mediterranean diet can benefit heart health even without weight loss. And some participants actually did still see reduced abdominal fat, even if they didn't lose weight on the scale. This means they had a smaller waistline, more lean muscle mass, just from eating this more plant-based diet that focuses on lean meats, veggies, fruits, whole grains. And this was compared to those who ate low fat and low carb. In our Donor of the Week today, we highlight someone who's proving it's never too late to make a difference. She's 90 years old. Jean Graham has rolled up her sleeve as a first-time blood donor recently, reminding us that even the smallest act can have a big impact. She joined us on our health show recently to share a powerful message of giving back.
I'm blessed. Yeah. I'm truly blessed. And I have an active lifestyle. And I try to take good care of myself, but this was something, a teeny tiny something that I could do to help out.
We love that. She said her daughter is living with ovarian cancer, really motivated her to do this, so we are praying for Sarah. Hawksworth's July promo includes this Reds Ringer t-shirt. The offer to receive this t-shirt runs until the end of the month. If you would like more information or to set up an appointment, call 513-451-0910. Finally, we leave you with Hope You Know, which is what we hope you know about your mental health each week. Pediatric mental health specialists recently launched a new program in our community aimed at saving children's lives. It is called Zero Suicide, and here's what it's all about.
Its focus is that zero, and its goal is to provide those who need care what Cincinnati Children's Hospital recently embraced that likely saved Kevin Galloway's life.
I want to share my story to help others dealing with thoughts of suicide.
Kevin and his mom, Tanya, and the Zero Suicide team from Cincinnati Children's recently joined us to share Kevin's story on our What's Happening in Health show. Kevin said school bullying and girl problems eventually put him in the hospital for weeks after he attempted to take his own life.
So what happened? You felt like there was no other way out?
In the moment, I did. But looking back now, I realize that that wasn't the way to do it. I should have talked to my mom and told her how I felt because she knew I was depressed.
Him and I had a very good relationship and very open, and we spoke pretty openly about mental health issues. I just didn't realize it had gotten this bad for him, and that in his mind he felt like he didn't have another choice.
Now Kevin works in a coffee shop at the hospital, and the Zero Suicide team knows his recovery and story could help save others' lives.
After I got to know Kevin a little bit, I realized just in terms of the strength and the ability to convey this message of hope, that really is a 1 in a million phenomenon.
As for the commitment to zero suicide,
the only acceptable number of losses is zero. So it's really calling healthcare systems to this aspirational goal of zero suicide, with the recognition that when we strive for zero, patient deaths and suicide attempts, organizations function very differently than looking for a reduction.
We do remind you that if you or someone you love needs urgent suicide intervention, 988 is open 24/7. All right, just ahead, some changes happening at Metro this month. We're going to share how those could help your ride in Healthy on the Go. It's all coming up in our next half hour. Stay with us on What's Happening in Health.
The headline medical stories that affect you and your family. This is What's Happening in Health, sponsored by Mayfield Braden Spine.
Morning, everybody. Welcome back to our second half hour here on What's Happening in Health. Got a great rest of the show for you today. Some big changes happening at Metro this month that could help with your daily commute or wherever you take Metro these days. Here to tell us more about some of these changes and some of their renewed mission, we want to welcome the new CEO, Andy Aiello. Great to have you here today. And our Chief Communications and Marketing Officer, Brandy Jones. Welcome back, my friend. So nice to have you here. And what's more important than teaching children to speak up? The author of a new book called Tony and the Scary Thing, a story about using your voice when scary things happen. She's joining us today. We want to welcome Troyana Barnes. Hi, friend. Good to have you here. We can't wait to hear why she says this is so important. But first, a quick headline for you today on the dangers of sitting. Not only is it hard on your waistline, but there is a saying now that sitting is the new smoking. because it's hard on everything from your brain to your back. Most workers actually sit about 8 hours a day. The team at Mayfield Brain and Spine says since you likely can't change your job or the reason you sit, you may have to change a few habits. Getting up at least once an hour, just standing or moving takes the pressure off your spine. It at least lowers the risk of some of the sitting dangers. And now to our top story this half hour in your healthy future. West Nile virus now in several mosquito pools in the tri-state. The health department has been tracking those in several areas. No humans so far have been infected, but our Local 12's Paige Barnes says health officials are encouraging everyone to check around their home for any standing water and to use bug spray with DEET.
Bird baths, gutters, and pools can become a breeding ground for mosquitoes. The county health department says the entire life cycle can happen within 7 days, from egg to adult.
Just take a look around your property. You'll find things that you may not even think about that may be holding enough water to allow mosquitoes to breed and populate your neighborhood.
Hessel and his team routinely set traps at homes and parks around the county. He says they send the vial of mosquitoes to the state to be tested for West Nile virus.
There's a fan that's pulling the air up through here. And when they land under here, it pulls them up through those holes and they are captured in this net.
If it comes back positive,
we're either trying to dunk it with mosquito dunks, drain it, or talk to the homeowner on how they could prevent mosquito larvae or mosquitoes from breeding in that body of water.
Hessel says dunks prevent larvae from developing into adults. Adding a water feature to a pond or fish can disrupt breeding.
It does disturb the water enough to create ripples on the top. So that prevents the larva from coming up to the top of the water and breathing. So that disturbs it enough to prevent that.
He says mosquitoes are most active when the sun is about to rise and set.
I know it's kind of silly when it's really hot like this, but long sleeves, long pants, light colored clothing also helps.
Paige Barnes, Local 12 News.
Thank you, Paige. And she adds that mosquito-borne illness symptoms include fever, headache, and muscle or joint pain. In healthy innovations today, St. Elizabeth Healthcare becomes one of the first in the nation to use a 3D endoscopic cardiac surgery system. As this video provided by the hospital shows, this cutting-edge technology enhances the precision and safety of minimally invasive cardiac procedures. It's used in valve procedures mainly and replaces the need, in some cases, for a full open procedure. It's all possible because high-definition endoscopy in 3D allows 5 times the magnification on a screen. This can lead to faster healing, fewer complications, and quicker recovery for patients than an open procedure. All right, up next, a few changes coming to Metro we want you to know about and some good things they've added too. We'll tell you about it coming right up. And Andy Aiello and Brandy are here to do that for us. We have a great segment, Transportation in Your Health, called Healthy on the Go. It's here and what's happening in health.
This portion of What's Happening in Health is sponsored by Life Enriching Communities, NKADD, Hawksworth, and Aptiva Health.
In Look Good, Feel Better today, local mom says if you've had a lifetime of challenges, don't give up. She found hope and help at Central Clinic Behavioral Health. Her name is Nicole, and this is video of her at that clinic with her counselor, Brian. She said after growing up in multiple foster homes, she developed PTSD as an adult. And one of the things that helped her after she was having suicidal thoughts was setting boundaries. She learned to do this with a type of behavior therapy called dialectical behavior therapy, or DBT. That therapy helps you find specific behaviors to manage intense emotions. It also can help you develop healthy coping mechanisms and improve personal relationships.
When I'm really anxious, how do I regulate myself? How do I calm myself? How do I learn to self-soothe myself?
Just learning those things that help me get through the moment, get through the hardest times.
Nicole is now the mom of 2 children with special needs, and she says she can meet their needs because of the way she was now working with this team to teach her all those skills. She takes it now one day at a time. We love those stories. And we love our team from Metro. So nice to have you in-house. Hello to Brandy again. Remind us who you are and what you do.
Hello, I'm Brandy Jones, Chief Communications and Marketing Officer at Metro.
And you brought friends.
Yeah, hi, I'm Andy Aiello. I'm the CEO at Metro.
So I've had the privilege of speaking with you, but you're newer to this role. Tell me a little bit about that.
Yeah, so I've been the CEO for just over a month. I've been with the organization 3 years, and I was previously the CEO at Tank in Northern Kentucky for 12 years.
Wow.
Yeah.
So you sort of are getting the month of all months. You guys have not changed rates or made changes to a lot of your, kids' routes and things like that in a long time, right?
Yeah, we're constantly evolving the system, though. If you recall, back in 2020, the voters in Hamilton County passed Issue 7. So we've been making dramatic improvements to the transportation system. We're talking about health. Access to health care via transportation is absolutely critical. So we have included many system improvements that directly connect people to health care. We have 24-hour routes for the first time in Hamilton County's history. We have crosstown routes that we've never had before, and our ridership continues to grow, which means we're providing access to the places that people want to go. And with that, we have to keep up. We have to keep up with technology. We have to continually evolve our service to make sure that we can be accessible and sustainable in the long term.
So I love that. Brandy and I have had this wonderful conversation that it doesn't matter how good your doctor is or how healthy you eat if you can't get to the grocery store or get to that. So it's sort of been a passion for us to talk about that connection with healthcare. And it is part of your mission, is it not?
It absolutely is. And we continue to evolve and grow our service, as Andy stated. And so beginning on July 16th, our customers will see some slight changes in our fare policy. There will be a 20-cent, it's a very modest increase on our base fare. So you can travel anywhere in Hamilton County for just $2.20. And we're also seeing a change to our children's fare. Previously, if you were 2 and under, you rode Metro free, and 5 and under was half fare. So based on some feedback we got from our customers about how to help families who are traveling with small children, now 2 children under 55 inches, which is the average height of a 10-year-old, according to CDC, can ride free with a paying adult. So that's really one change that we're really proud of. It's going to help families be able to navigate our system even greater.
So this is interesting. We have a little video of kind of your general buses.
Mm-hmm.
Do you actually height measure, or I just have to ask that question because I read that it's so unusual.
Yeah, there's actually a stripe on the pole on the bus that lets the bus driver know whether that passenger is under or over 55 inches, kind of like when you're at an amusement park. It takes the guesswork out of it, and it makes it a lot simpler for families and the operators, so they're not disputing age. It's a very clear marker. It makes it easy for everybody.
That's so interesting. And kids do love to jump up against those markers.
They do.
I'm big enough or I'm not. So tell me a little bit sort of what's behind the changes. You've almost evolved to not just being one service that might go around our community, but to several.
Correct. The fundamental base of our transit system is our fixed route transit routes. Those are the big buses that you see traveling all throughout the region, right? That system has grown and expanded and provided more connection. But we're also layering new transportation options on top of that. We have a system called Metro Now, which is an on-demand kind of Uber Lyft-like system, but it's only $2.20 and it helps you get to where you need to go. It operates in zones. So we started with one zone about in 2024. We added 2 more zones since then, so we're up to 3 Metro Now zones, and we have plans to launch a 4th zone here in 2025. So this is using technology to close those first mile and last mile gaps. And as Brandy said, get families to healthcare and the services and the grocery store that they need to live a healthy life.
So am I allowed to ask where the next expansion is on that? Are you giving it up?
Our next Metro Now expansion is coming late 2025, early 26, and it's in the Blue Ash area.
Oh, excellent. Because I know you do research, right, to sort of look and see where the need is?
Absolutely. And what we've seen on our Metro Now service is that Kroger continues to be the #1 destination. So when you think about helping families access healthy foods and the resources that are already in their neighborhoods that maybe was just too far to walk to, they can now use this Metro Now service to request a pickup at their home, and they can go anywhere in that zone for one very affordable fee. So we're really excited about this new service. And not just that, when we think about the increases that are happening with our fare and even the children fare, we've layered that with rider reward programs and tap and save. So when you use the app to pay your fare, it will only charge you the lowest possible fare. So maybe you're someone who at the beginning of the month you couldn't afford to buy a 30-day pass. You just didn't have the funds available. And if you were paying every time you rode, you may exceed the cost of what it would have been to purchase a 30-day pass. The Tap and Save program now captures every time you ride, and the technology ensures that once you've reached the amount of a day pass or a 30-day pass, the rest of your rides are free beyond that. So we're really excited about these programs that are helping our customers put more cash back into their pockets, and thank them for choosing Metro every day.
Yeah, you know, I do, and we have seen growth in, you know, where you go, and I think in the summer, you know, it's the air-conditioned ride and you're not downtown, you know, trying to fight to park. Did I also hear some more expansion with rapid transit, or how is that going?
Yeah, we are studying 2 corridors, the Hamilton Avenue and the Reading Road corridors, and we're implementing what's called bus rapid transit. We are about 30% through the design process for that, and it's essentially rubber-tired light rail. So these are buses that will move quickly through those corridors. There will be stations about a half to a mile spaced, and that bus will pull up to the station just kind of like the streetcar, and folks can board flat in and flat out and then be on their way. What we've seen is bus rapid transit throughout the country has resulted in economic development. Businesses like to locate around the stations. It creates economic opportunity and density in our city. And part of what Metro's challenge to do is to help this city grow. And bus rapid transit is going to be a huge help in continuing the economic development of Hamilton County.
So for a third of the way, do we have any idea when that might?
Yes, so we're planning to finish design in 2026. We'll start construction in 2027, and the system will be operational in 2028.
Interesting.
Yeah.
Well, we love that.
Yeah.
Okay, my favorite thing to ask before we go, just a little bit about, you know, there's sort of always things that you learn or know as you learn more about this type of transit, and you always say, I want people to know this. What is that for you?
Well, I think that for folks that use transit, the reason they use it because it's so easy. And for folks that haven't tried it, they believe that it's hard. So really what you need to do is get out. We have this thing called the Transit app. So if you download the Transit app on your phone, it's just like Google Maps. You put in where you want to go and it'll tell you exactly how to use the bus system. I'm a bus rider. My children grew up riding the bus, getting to school. I think the biggest hurdle is just get out there, try it, give us a call. We're there to support you. And you'll be amazed at what you'll experience. Clean buses, friendly drivers, and an excellent way to get to work.
Well, thank you, and thanks for getting him here, because we know you're newer to the role, and we were told you're super busy, so we're honored. Thank you, Brandy.
Thank you for having us.
Yeah,
it's interesting, really
Great
interesting to hear about what you're doing. All right, look forward to more very soon. Okay, coming up next, if you find more joy going for a run than a workout class, there might be a reason. We'll explain why and wait no more. And Triana Barnes is in the house. She's going to talk Tony and the scary thing. We'll tell you about using your voice on what's happening in health.
This portion of What's Happening in Health is sponsored by Miami University, the Vein Center of Cincinnati, and Lindner Center of Hope.
In Wait No More today, if you find joy or more joy going for a run than attending a workout class, there may be a reason. A study found that personality traits can predict the intensities and forms of exercise that attract us. The more extroverted people, when they studied those people, they found they preferred high-intensity workouts with other people, while those who were sort of neurotic, they were the people who sort of had emotional instability, they say. They want private workouts, private conversations, no crowds. Researchers say tailoring exercise programs to your personality could help you really get the best benefit from exercise. 132 people between the ages of 25 and 51 years old completed questionnaires to reveal a personality type. The study was then published in the journal Frontiers in Psychology. All right, on now to a wonderful new author in our community. Tell us a little bit about you.
Hi, my name is Triana Barnes, as you said, and I am a mental health therapist and published author of Tony and the Scary Thing. This is a bibliotherapy mental health book to allow parents and caregivers to have a resource to talk about challenging subjects like trauma, stress, and daily hardships.
So rarely do we ever write a book or express our thoughts without seeing a need. So I'm guessing that you saw that this was needed because?
Because in my practice as a therapist, I saw many children struggling with trauma and parents and caregivers not knowing how to have that conversation. We tend to think that children don't experience these scary things, and It's unfortunate, but they do. So we have to have more tools to have these tough conversations so that children know that it's okay to talk about these things and we can demystify these conversations.
Interesting that you would say that. Is there an age that like this is sort of targeted to or for?
So I wrote it for about 5 to 10. However, I've noticed since its release that everybody has been getting something valuable from this book. So I would truly say that it needs to be in every household just to give people a resource to talk about it no matter the age.
Yeah, even if you have something to refer to, you're like, oh, it makes sort of the natural way a conversation would come up.
Yeah.
So can you tell me a little bit about Tony?
So Tony, he has experienced this really scary thing, and it walks us through his challenges with his emotions and the things that he's experiencing. It walks you through him being a little nervous, and he's like, should I tell my parents? You know, and it walks you through how he overcomes that, the questions that he has, how his parents respond, and it ends with a really encouraging message at the end.
So what ultimately was your goal? Just to start the conversation or just to even bring up something we never talk about?
So the goal was to bring up the conversation and provide a resource for parents to have that conversation at home. There's other resources inside to how do you connect with the mental health counselor? How do you handle these conversations if it's not something that goes as far as therapy? How do you just talk with your kids about daily hardships, right? I've noticed that parents just don't know how to have those conversations, so it has a dictionary in the front about what is, you know, mental health, what is trauma, and it breaks it down, and then at the end there's a little activity for children to share their story. So the goal was to just get people talking and then connect them to the proper resources to process trauma.
So those are really good points. In news, we try to always explain, and I've learned that trauma has a very broad brush. So what do you consider trauma?
Trauma would be anything that someone experiences that they can't, one way to tell that if someone's traumatized is if they can't stop thinking about it or it's causing some type of disruption in daily functioning. So you know that you have experienced a trauma if it's starting to mess with, you know, you can't get out of bed, you're struggling to eat, you're struggling to make friendships, you're starting to isolate. That's how you know that you have experienced a trauma if it started after a certain big event.
So then can you give me some examples, because you know we always think of it as violent trauma or sexual trauma, but that's not necessarily, based on your definition, the only thing it might be.
Right. There's even some conversation that children, I mean, all people are traumatized by grief. Say you lose a parent, that can be really traumatizing. Or extreme poverty, the things that you experience in the home, within the community, all of that can be considered trauma. It's not just one area of things that are considered trauma. It can be anything. And I also want to point out that you can go through something challenging and it not turn into trauma. Trauma is when it begins to affect you to the point where it's affecting your functioning. So it's all different for each person, but you can go through something scary and not experiencing trauma, and then another person can go through the same thing and be traumatized. So it's...
And we all process differently. All right, so final thoughts, and then I want to have you just tell us where to find it and whatnot. Okay. Was this freeing for you? Were you a person of trauma? You know, lots of times we're connected to things, so I wondered kind of why you wrote it.
Yes. So I wrote it because I have experienced different levels of trauma in my life, you know, sexual abuse and other things. And I noticed that within my community, within the African American community, we don't always have the tools to have these conversations. So I was like, we really need something to take home that we can use to talk about this. It doesn't, and it's very kid friendly. So you don't have to make it really complex and daunting. It gives you a tool to just kind of make it seamless, and it gives the child the space to lead the conversation, and it shows you what their comfort level is with this topic, and it gives you the tools to support them.
So what that really says is you can heal. Just look at you. Yeah.
Yes, you can.
Good for you. All right, so how do we find it? We have a cover of the book. How do we find it? Where is it? How do we order it? That kind of thing.
Yes, so you can find it on my website at TrianaBarnes.com. You can also find it on Amazon, Tony and the Scary Thing. But if you go to any of my social medias, Triana D. Barnes, you'll be able to find it, and there'll be a link to it.
All right, we'll put that, of course, at what'shappeninginhealth.com so people can find it as well. Thanks for keeping it real with us. It's really interesting. I look forward to following up with you as people kind of pick this up and start talking about it.
Yes,
it's
thank
very
you.
Interesting. Pleasure to meet you. Okay, just ahead, C-sections and cancer risks. We're going to share new research in Your Healthy Rights. And look who's in the house, our team from Mercy Health here and Mayfield Clinic as well. They are joining us. Nurse Molly's here along with Cheryl Klum. A remarkable story coming up about reducing a kind of paralyzing pain. Can't wait to tell you about it in our next half hour on What's Happening in Health.
This portion of What's Happening in Health is sponsored by Network for Hope, William E. Hesch Law, Serene Suites, and Surgeonista.
In You're So Vain today, a warning about diet and pregnancy and a baby's risk for diabetes. We know that diabetes can impact your vascular health, and now a study published in the Journal of Epidemiology and Community Health highlights the impact of a pregnancy diet on childhood diabetes risk. It links maternal consumption of inflammatory foods such as sugary drinks, red meat, to an increased likelihood of children developing type 1 diabetes. Now, this suggests that dietary choices during pregnancy could play a role in the prevention of this autoimmune condition. In Your Healthy Rights today, children born by C-section have a slightly increased risk of developing certain cancers later in life. This according to a new Swedish study. It looked at planned C-section births. There was a 21% increased risk of one type of childhood leukemia. While the reasons are not known, researchers say it's possible that children born through vaginal birth are exposed to bacteria, which could increase resistance to some diseases. All right, just ahead, mental health services in our community. Big announcement recently that forms an important partnership. We're going to meet Danny Green, Chief Clinical Officer at Best Point Education and Behavioral Health, and Victoria Taylor. Look right into that camera and give me a hello there. There we go. She's the Chief Clinical Officer at Butler Behavioral Health. Stay with us. We'll meet them next on What's Happening in Health.
The headline medical stories that affect you and your family. This is What's Happening in Health, sponsored by TriHealth.
Welcome back, everybody, to our third half hour here on What's Happening in Health. Got a great rest of the show for you. This is gamma knife technology, and it fights a unique kind of pain. And those who suffer from it say it's pretty awful. We're going to hear about that and how this technology can help change lives. We want to welcome back Cheryl, who's our patient, and Nurse Molly from Mercy Health. We are so glad to have you guys here to hear a little bit more about what's called trigeminal neuralgia. And two organizations are combining services in Butler County. They're going to provide expanded mental health coverage. In this half hour, we talked to Danny Green, Chief Clinical Officer of Best Point Education, and Behavioral Health Specialist Victoria Taylor. She's also the Chief Clinical Officer at Butler Behavioral Health. A unique partnership, and we can't wait to tell you more about it. But first, it's been a busy week in Wilmington. This is video of Clinton Memorial Hospital. They will soon become the 6th TriHealth hospital in our area. We spent some time here this past week to learn a little bit more about just who they are, why they are teaming up. Here's some of what the staff and the TriHealth CEO shared with us.
It's definitely a wonderful small community, and the staff is amazing here. There's a lot of opportunity here. Our patients become our friends, our family, same thing with the staff. It's a close-knit community, and I think especially here we see that we can do a big impact.
It's a place that we do really big, great things, but it's small enough that it's home, and you know everyone.
You know, one of the things that makes TriHealth unique is the culture that has been built over the years, and we put our patients first. We create a really, I think, a welcoming environment for patients to be cared for within, and for our staff to care for our community. And we really focus on, you know, building a culture of inclusion and belonging. And it's really what sets TriHealth apart from, you know, many other health systems regionally and nationally.
So this transition expected to take place with the two hospitals in about the next 90 days or so. All right, on now to our top story this half hour. It is on frozen shoulder. Now, this often hits women and people with diabetes, but those who treat it say a few steps can help you get back your range of motion.
Frozen shoulder is an inflammatory condition which affects the ligaments around your shoulder, and it makes them freeze up, we say. So they're usually stretchy and they become very tight, painful, and the patient can't raise or rotate their shoulder.
Dr. Trevor Wilkes specializes in shoulder surgery at OrthoCincy. He says we don't really know what causes frozen shoulder, but it's likely related to your autoimmune system.
So attacking your own body, we know that it is almost 3 to 4 times more common in women, diabetics, and people with hormone problems like thyroid disease.
It may be that antibodies, he says, sort of attack the shoulder, so you have to work against this process.
What am I looking at here? Okay. So this is an MRI of the shoulder.
He starts by suggesting physical therapy.
Usually they get a cortisone injection first. That'll help with the inflammation, get things moving. And then they come in here pretty frequently, typically 1 to 2 times a week at least. And then at home they're doing relatively aggressive therapy, like 2 to 3 times a day to get that motion going.
Now, as with any condition, early intervention is key. In many cases, this does resolve in about 18 months. If not, pain relievers often the next step, and they can put those right into the area that hurts. In Waiting for Life today, we highlight a local tournament with purpose. Golfers can hit the green for the National Kidney Foundation. They have their golf classic coming up. It's called the Road to Pebble. Funds from the event help the foundation provide free screenings, patient support. It can raise awareness for kidney health as well. Perry Hall from the National Kidney Foundation joined us recently on our health show to share a little bit more about this event.
And it really is to raise awareness and really pull in corporations that not only want to treat their clients to a good time playing golf, but also raise the awareness about organ donation and kidney health.
Now, the Road to Pebble actually allows the top winners to play at Pebble Beach. This is at TPC Rivers Bend in Mainville. It is Monday, August 11th. And if you'd like more information, go to what'shappeninginhealth.com. All right, up next, you want to age gracefully. You might be surprised what's making you old before your time, as we say. And we're going to meet Molly and Cheryl. They are here to talk trigeminal neuralgia. Don't let that word scare you. It's probably more familiar than you know. It's all coming up on What's Happening in Health.
This portion is sponsored by Good Samaritan College of Nursing and Health Science and the Mental Health Recovery Board of Warren and Clinton Counties.
In Aging Gracefully today, there's some things that age us quickly and others that add years to our lives. But if you want to not age quickly, you need to do strength training. You don't age as well if you don't do weight training, and it's all because it reduces your fall risk, which adds years to your life. Leanne Clift of Ohio's Life Enriching Community says if you work out with others, it also helps your socialization. Here's why a couple of those things are important.
The more you do, the more active you stay, the more you're working those different parts of your brain.
So a couple other habits that age you quickly include not taking days off, dehydration, not protecting your hearing, and being negative, as well as not making plans, the lack of a social life, sitting all day, and as she mentioned, not challenging your brain. If you'd like more information about Life Enriching Communities or maybe getting in some of these activities with others, they do have free community events. It's 877-532-1899. All right, on to our wonderful friends here from Mercy Health. We want to welcome Molly and Cheryl. Tell us about you.
My name is Molly Egnott. I've been a nurse for about 12 years now. ICU trained and came to Gamma Knife in 2018. And I've been there and I've kind of worked my way up to being the clinical coordinator of the department.
No small thing, is it?
No, it's a lot, but I love it.
So what do you treat there?
We treat trigeminal neuralgia, benign brain tumors like meningiomas, and then we also do cancerous tumors in the brain, metastatic cancer, so breast cancer and lung cancer that go to the brain.
Interesting. We have our wonderful patient here. It's been so fun to sort of get to know you better. I met you initially at one of our health fairs, but you said you'd done the story and you guys started doing research, and you are well now, feeling good?
I am
pain-free since December. I do have partial numbness on the right side of my face, but much rather have that than the pain.
Yeah, you know what? We all we all take what comes in balance here. Well, part of the reason you've had that pain is due to this facial pain condition known as trigeminal neuralgia. And Kathy DeRosset, who's your daughter, and Cheryl Crum did a story with us just recently, and they discovered it was something else when they first thought it was a dental problem. Watch this.
Dental procedures.
I had 2 root canals, and then I had the tooth pulled, and then I still wasn't getting any relief.
Kathy had an MRI. As Dr. Ronald Warnick of Ohio's Mayfield Brain and Spine showed me,
and we're targeting the nerve right here.
It confirmed it was indeed trigeminal neuralgia that was causing her pain.
It's a short circuit within the trigeminal nerve that leads to firing of the nerve when it shouldn't fire, and that is perceived by the brain as pain.
Kathy was diagnosed first, her mother Cheryl a few years later. Both say the facial pain is so bad.
Felt like somebody held a live wire up to my cheek. It was electrocuting me. And at one point, it was so bad that I actually thought I could smell smoke, burning sensation.
Luckily, Dr. Warnick is one of a handful of specialists in the country who specializes in treating this condition here at Ohio's Jewish hospital Mercy Health. As this demonstration shows, he uses what's called a gamma knife.
A gamma knife contains cobalt, which when it decays, it gives off gamma rays, which are, think of them as pencil-thin, almost laser beams of radiation. There are 192 that intersect on a point.
That point for both Kathy and Cheryl was the trigeminal nerve.
I have been pain-free since probably last December.
Over time, this appears to form scar tissue and stop the short circuiting, which stops the pain.
Nope, no pain. My right side's numb, but I'd rather have the numbness than the pain.
It was very interesting to me that both of you said it's better to be numb than hurt. I've heard this can hurt so bad it's almost like the breeze on your face hurts. Is that true?
It's just intense pain, like being electrocuted. Especially I've had times the pain was continuously. It would stop. I mean, at one time I had a pain for about 30 minutes in the side of my face. And then that's actually before we even realized what was going on. I thought it was a toothache, had several dental appointments, had x-rays, scans done. It's not a tooth. And then they suggested I have an MRI and did come to the conclusion it was the trigeminal neuralgia. And Dr. Warnick talked to me, gave me several options. And when I did have the intense pain, one time when I thought I could smell smoke and my skin burning, and I said, that's it, I want surgery. Called Dr. Warnick.
So you probably see a fair amount of patients that get to this point?
Oh yeah. Unfortunately, I don't think it's really widely known and talked about. So Dr. Warnick has given talks to the dental associations and sent out mailers just trying to educate dentists, just letting them know, let's not pull out teeth, let's send them to me, send them to a neurologist, and let's try to get down to the real root of the issue. So a lot of us, we take care of at least once a week. One of our patients is a trigeminal neuralgia patient. And honestly, it's really rewarding to take care of those patients because they come in and sometimes it's so bad, you know, you're in the middle of doing their intake and they're having a shocking pain and they stop talking. And even myself as a nurse, I'm like cringing with them because you can just tell how much it hurts. And some people have really good responses almost immediately. Sometimes it does take up, 2-3 months for the most response, but it's very rewarding. We see a lot of patients.
So what's interesting about that is that you tried all the other pain stuff and nothing touches it, right?
Right. Oh, I tried 3 different medications over probably about 5 months, and the pain just kept getting worse. And I said, that's it. I want surgery.
Yeah, the misfiring thing is very interesting because if something's firing, it isn't going to matter what you're doing. Yeah.
Right. You can't even move your tongue. You cannot eat, cannot talk.
Yeah, I think you told me you were living on mashed potatoes or something.
Mashed potatoes and tomato soup. Yeah, I don't want to look at it anymore.
She's like, just give me a cheeseburger, please. Yes,
I know. One time I said, I would just want a fried chicken leg. Let me bite into a fried chicken.
See, the little things we take for granted, pain makes you so humble because it really overrides every other need. So what is it that you feel like we should share? This is an amazing thing, but as you said, people just aren't aware.
Yeah, I think if you are just kind of having this sharpshooting pain, obviously go to the dentist to see if it is a tooth, but if the dentist doesn't see an abscess or any issues with the root, then I would seriously suggest going to a neurologist or seeing Dr. Warnick at Mayfield to kind of see if he knows what's going on, because it very well could be trigeminal neuralgia.
Yeah, and I bet you just want people to know there's hope.
Just get the word out that yes, there is hope, and just keep on pushing. If that you keep having the pain, you're not getting the right answers. The best thing is to have an MRI. My primary care is the one who prescribed it, but
life-changing.
Yeah, life-changing, yes.
Boy, we are so glad to talk to you. Thank you for not giving up. Thank you for supporting these patients the way you do. And it's a pleasure for us to share these stories and have people reach out for help. It really is. It just is, it's life-changing for us too. So thank you.
Good.
Good to have you here. All right, up next, how hearing aids can improve your social life. We'll have details on that and listen to this. And we're going to talk to Danny and Victoria. They have some expanded mental health coverage in our community. We'll be sharing more about that coming up on What's Happening in Health.
This portion of What's Happening in Health is sponsored by Northern Kentucky Audiology, the Center for Closing the Health Gap, and Journey Light.
Welcome back, everybody, and listen to this. People who receive hearing aids and cochlear implants to improve hearing also saw improvements in social lives. A study by USC found people who had their hearing loss addressed successfully became more socially engaged and felt less isolated. Social isolation can increase the risk of anxiety, depression, cognitive decline, as well as dementia. And that, of course, a good lead-in for all the many things that influence our mental health. We are such complex beings, aren't we? I think mental health is impacted by everything. Your family, your health. Tell us who you are and a little bit about you.
Sure. My name is Victoria Taylor, and I am the Chief Clinical Officer of Butler Behavioral Health. I've been there for 20 years this year, so been in the field for a long time.
Counseling and those other things?
Background in counseling. I'm a family therapist by profession, so working with kids and families has always been kind of a highlight of what I do.
God bless you. Boy, that's no small job. And I know you have friends here. Hello.
Hi, thank you for having us. I'm Danny Green. I'm the Chief Clinical Officer with Best Point Education and Behavioral Health. I'm a social worker by trade, clinical social worker. I've been with the agency for 10 years. I started as a therapist, and I currently now oversee all of our behavioral health programs across the agency.
Oh, all 28 of them. There's a lot. There's a lot. So we recently wanted to reach out to you because the team at Butler Behavioral Health is sort of calling this a transformation in our community, and it really might be. And they are combining to care for mental health needs. Watch this. The team held a news conference today to share more about a commitment and expansion for families in our region. They're merging with another organization to serve more people in Hamilton, Butler, Claremont, and Warren counties.
Today is not about an ending, but really a powerful beginning.
Now, this will allow them to expand from about 30 to 50 services and support children, teens, young adults. It will also deepen what they call the continuum of care across the lifespan, and it will allow them to grow to nearly 700 employees. Here's what they told us about this day.
This ribbon tying ceremony symbolizes a formal union of Butler Behavioral Health and Best Point Education and Behavioral Health. By coming together, we are building a stronger, more accessible, and more impactful behavioral health system.
When I think about the history of these organizations within the community, serving children and families and individuals for the behavioral health and educational services, it is unmatched.
We do day treatment services, we do med management services, we do education services, we do early childhood services. So we have more than 35 programs. Combined with Butler Behavioral Health, we'll have 50 programs.
This will create a broad region approach to care, and really will make it much more accessible for all communities in Southwest Ohio.
So tell me a little bit about that. Were you previously kind of separate services, and what does this bring?
We were definitely two different agencies. We do have some services that overlap, but we definitely have complementary services. Best Point definitely is well known for their educational and child and family services, and we also add to that adult and crisis services. So we're able to kind of expand throughout the entire lifespan with both of our services together.
And there are many agencies that can really do that, because a lot of times, you know, you're sort of specialized in kids or specialized in adults. So what do you feel like this brings that we sort of haven't had?
Yeah, you know, I think it really is the consistency of care throughout, as Tori said, the lifespan of services. So we can serve from infancy through adulthood, which is a core part of our mission, is to help get people to the best point of their lives from infancy through adulthood. And this merger will really allow us to be able to provide those services at any age throughout the lifespan and really wrap around what you need in order to be the best person you need to be.
So it's almost heartbreaking to hear you say that someone would need mental health care as an infant.
Yeah.
Tell me about those needs. What are they?
Yeah, so we do infancy, sometimes maternal mental health. We work a lot in conjunction with the parent and the child to help, you know, support the development and growth. We have early childhood services that start as early as, I said, 0 age. We have kids who at 3 years of age are getting kicked out of preschool because they're struggling to navigate their emotions. And so we wrap around in preschool settings. We have early childhood programs on our campus to be able to provide those services and build those skills up for individuals to be successful in their school settings and their natural environments.
And you know, it's heartbreaking to hear, but glad that you're available. So if I'm a parent and I have that child that's, I hate to say it, I had a nephew that was a biter, and he'd be in daycare and the same thing happened, you know, and we were like, what do you do? How does a parent reach out to you? What's the best way to kind of communicate and connect?
Sure. Well, the good news is, you know, we both have websites that you can immediately make a referral for. So all you have to do is either go to bbh.org or bestpoint.com, I believe.
Bestpoint.org.
Yeah, we'll put those on our website too.
And, you know, it's easy. It's just clicking a button saying make a referral. You put your information in there and kind of what services you're looking for, and you get a call back within 24 to 48 hours where somebody can connect you to care with some immediacy. Or you can walk into our offices at Butler Behavioral Health and immediately get an intake through our daytime hours. So we have a walk-in intake as well. So all of our services are accessed through that point.
And I know you will help with financial arrangements, or, you know, getting people connected with insurances and and things like that, because that's always what people say, what, you know, how do I pay for it? How does that all work?
Yeah, so we have care coordinators who can help with anybody who may need some resource support. So if we have families who are without insurance, or maybe they lose their insurance in the midst of services, we have providers who can help get those services connected and provide resources on how to obtain insurance so that they can still get the services that they need.
Yeah. All right, so final thought. We say that we're in the age of anxiety. Do we know what's driving that? Is it just all the changes in our environment now?
That's a good question. I think most of us would love an answer to that. I think part of it is just it's really acknowledged now. You know, where a lot of things, people are like, well, it just came out of nowhere, but they've actually been around for quite some time. I think people just really didn't acknowledge how much they were impacted by the things that happened to them and things that happened to their family if you're a parent. So, you know, you have that raising moment as well. I think there's also, you know, a lot of conversation around, you know, having the internet, cell phone, you know, all that stuff is
you
really
have
been an
everything
effect.
when you start to look up on the
Right.
internet. And to your point, you cannot heal from that which you do not acknowledge.
Right.
So, yeah, thank you for just talking about the tough stuff. We're going to continue to have you back and share as you grow, especially if you have patients that will kind of brag on you. We hope you'll come back.
Awesome.
Yeah, good to have
Thank
you. All right, just ahead, a new warning for childhood cancer survivors. We're going to explain why in Healthy Conditions on what's happening in health.
This portion of What's Happening in Health is sponsored by Mount St. Joseph University, Elder Law Lawyers, and Advanced Cosmetic Surgery and Laser Center.
In healthy conditions, people who've survived cancer as children have a greater risk for developing severe COVID-19. A study published in the journal Lancet found childhood cancer survivors were 58% more likely to be hospitalized or die from COVID-19, and the risk exists even decades after cancer treatment ends. This does suggest that childhood cancer survivors should be prioritized for receiving vaccines. That is it this week for What's Happening in Health. We are back same time next week. We hope that you will be too. Until then, everybody, stay well and stay tuned.